Hello everyone and welcome back to MediInsights. Today we're talking about Benazepril Tablet, a commonly prescribed ACE inhibitor used to treat high blood pressure. I'll explain what it's for, how it works, typical dosing, common side effects, and the safety tips you must know, so you stay informed. Let's talk about the conditions Benazepril helps treat. Benazepril is mainly used to lower high blood pressure, either alone or with other medicines, to reduce the risk of stroke and heart attack. Lowering blood pressure helps protect the heart, brain, and kidneys over time. If you have other conditions, your doctor will decide if Benazepril is appropriate for you. Here's how Benazepril should be taken and how much to use. The usual adult starting dose is 10 milligrams once daily for patients not taking a diuretic. If you are already on a diuretic, doctors often start Benazepril at 5 milligrams once daily and adjust from there. Typical maintenance doses range from 20 to 40 milligrams per day, and doses up to 80 milligrams daily have been used under supervision. Always follow your prescriber's instructions and never change dose on your own. Let's talk about how Benazepril affects your body or symptoms. Benazepril is an angiotensin-converting enzyme inhibitor, which means after it becomes active in the body, it blocks the enzyme that converts angiotensin 1 into angiotensin 2. By lowering angiotensin 2 levels, blood vessels relax and blood pressure falls, and aldosterone release is reduced, which affects salt and water balance. This combined effect lowers the workload on the heart and reduces vascular strain. As with any drug, there are possible side effects to watch for. Common side effects include cough, dizziness, headache, fatigue, and nausea, and these are usually mild. Serious but rare reactions include angioedema, significant drops in blood pressure, elevated potassium, and worsening kidney function, which need immediate medical attention. If you experience facial or throat swelling, difficulty breathing, or severe lightheadedness, stop the medicine and seek urgent care. Lastly, some important reminders and precautions. Tell your doctor about pregnancy, or if you plan to become pregnant, because ACE inhibitors can harm the fetus and should be avoided in pregnancy. Mention all other medicines you take, especially potassium supplements, potassium-sparing diuretics, NSAIDs, or drugs that affect kidney function, since interactions can raise risks. If you have significant kidney disease, your prescriber may start at a lower dose and monitor kidney function and electrolytes closely. Always take Benazepril at the same time each day, and do not stop it suddenly without medical advice. Thank you for watching MediInsights. I hope this made Benazepril clearer and easier to understand. If this helped you, please subscribe to MediInsights and leave a comment with any questions or topics you want next. Your feedback helps us make better medical explainers. See you in the next episode soon. Bye.